Good evening, everyone. Good evening, good evening. I'm seeing some of you. Please make sure that you are muting your cameras. I don't want to hear any private background noises, please. Usually I have this, done automatically, but I guess I didn't do it this time. All right, good evening, everyone. Well, thank you guys for being here. I know it's 8 o'clock on a Tuesday, and all of you are probably exhausted, more so if you are parents, but thank you so much for coming. I really hope that you find value in these webinars. I'll introduce myself in a second, but I do these webinars, I facilitate them once a month on different topics. So thank you all for being here. Let me just make sure I admit everyone. And you can turn your cameras on, you can turn them off, however you want to do this, but just make sure that your audio is off, please.
Yes, I think a video, you don't want to.
All right, we're gonna start in just 1 minute. And this is recorded. I just had a message from someone saying that they couldn't make it. They were going to have to leave mid-presentation. That's okay, because this will be recorded and all of you will receive a copy. All right, I think we can start. Oh, you can hear me? Okay, let me make sure that it's
I can now, but because my volume was muted by accident.
Can you guys hear me?
I'm having trouble connecting to the internet.
Okay.
Info. Check the home app.
You can also hear Siri, I'm sure. All right, just making sure you guys can hear me. Good, perfect. I'm not sure why you can't hear, I'm sorry. Good evening, Gabriel, thank you for being here. All right, let's get started. So my name is Dr. Monica Gilbert. I am a clinical licensed psychologist in the state of Florida. I'm also a board certified behavior analyst and an LMHC. And as I was stating, I do these webinars once a month. So any topic that you want to hear about, please let me know. I'm always open for suggestions. And keep your questions, keep them going. I love answering questions. And today we're going to actually speak about anxiety and ADHD, understanding the connection for kids and adults. All right, so let's get started. So before we start with all of our great content for the night, I'm going to just introduce a couple of things that I do, because I often get questions about, where can we find you, or where can we ask you follow-up questions. So these are some of the services that I provide. These are some of my companies. So Crystal Mind Psychological Services, we do mental health psychological treatment, we do individual therapy, we do family therapy, group therapy, and then we have Crystal Minds New Beginning, where we do ABA therapy. I have a whole group. We travel all over Dade, all over Broward. We go to the homes, the schools, the jobs, because we do have some adults that we provide ABA therapy for. And that's basically what we do there. We also have preteen groups. We have social skills group. And then I have the MI Doctor, where I do some of the parent coaching, school consultations, entrepreneur individual therapy, and things or therapies and coaching that are based on motivational interviewing. So I know this is a lot, but if you guys have any questions, you can always find me online on my social media. You can send me an email, whatever it is. At the end of this presentation, I actually have a manual that I will be giving you guys. So don't worry about taking notes or a copy of this PowerPoint, because the manual will have everything. All right, so let's get started. I'm going to be multitasking here, as I usually do, having people come in and doing all this good stuff. All right, so you guys have the chat. If you have any questions on the chat, you can just type it there. If you want to ask it privately, you can also ask it privately. I have no problem with that at all. And you can unmute yourselves. Just raise your hand, let me know, and you can unmute yourselves and ask the question out loud if that's what you want to do as well. All right. So what do you guys think? ADHD and anxiety, are they friends or are they frenemies or enemies? What do you guys think? Put it in the chat. Okay, I see someone put comorbid. Great, thank you, Gabriel. So comorbid actually means when two things or two disorders or many disorders coexist together. So they are comorbid. That is a clinical term. So someone says comorbid, friends. Anyone say enemies, ADHD and anxiety? So most people, cousins, okay, yes, very witty, very good. Good evening, Diana. Thank you for being here. Welcome. They're BFFs, okay. Enemies, all right. So let's talk about a little bit more. So we're gonna do a quick review on ADHD. And just so you guys know, ADHD is a neurodevelopmental disorder. Neurodevelopmental is just a very fancy term for saying that it's developed from a very early state, right? So it's not like you acquire ADHD later on in life. You have it from the start. And it is really characterized by inattention, hyperactivity, impulsivity. We'll get into the different types of ADHD in a bit. And it affects children, adolescents, adults. And generalized anxiety, or GAD, is marked by that excessive worry and anxiety about various aspects of life. Generalized anxiety disorder is actually the anxiety that we all know to be anxiety, but it's part of a cluster of anxiety disorders where we also have social anxiety disorders and other types of anxiety disorders as well. So let's see if they're enemies or frenemies or friends. And I think at the end of this PowerPoint, you'll get a clear view as to what they are together. So the impulsivity associated with ADHD may sometimes lead to a carefree attitude that minimizes anxiety in certain situations. So both of these conditions can benefit from certain types of interventions and coping mechanisms, potentially creating a symbiotic relationship. So this over here gives us evidence that perhaps they're more friends than we thought. So the other part of this is that the restlessness and distractibility in ADHD may exacerbate. Exacerbate just means that it's going to make it worse. It's going to exacerbate feelings of worry and stress in individuals with GAD. And the high anxiety levels in GAD can be intensified by challenges in focus and organization that come with ADHD. The impulsivity of ADHD as well can lead to impulsive decision-making that may trigger or worsen anxiety symptoms. So this is like a really quick run through of their relationship together. You're absolutely right, Gabriel. It makes individuals exhausted. I think if you have whichever, right? If you have ADHD or anxiety, or maybe both, you feel exhausted. And there's a couple of reasons why that happens, and we'll kind of go over that. But yes, you're absolutely correct. It also makes caregivers exhausted, right? When they have children with ADHD. So let's get into ADHD. So what is ADHD? And this information comes from the DSM-5. I'm not going to bore you guys with all this technical language, but basically the DSM-5 TR is what we psychologists and clinicians use to provide diagnosis, right? So this is a book that we look at, and then if you meet the criteria, then we give you the diagnosis. We should also be testing you and doing other objective measures, but just so you guys know what the DSM is. So ADHD, attention deficit hyperactivity disorder. This is a pattern of inattention and or hyperactivity or impulsivity that interferes with functioning or development. Again, if it doesn't interfere in your functioning level, if it doesn't interfere in you making friends, if it doesn't interfere in your job, in your school, then it isn't really a disorder. It will only be a disorder if it's really interfering in your life. So the interesting thing, and the thing that a lot of people don't know, and you guys will know after this webinar, is that there are actually 3 types of ADHD. We have inattentive type, we have hyperactive type, and the third one is a combination of hyperactive and inattentive. So show of hands, who knew that here? So who knew that there were 3 types of ADHD? Okay, we see me. Who else?
Me.
Okay. You knew it too. Awesome. All right. Okay, so a lot of you knew. Okay, so, well, for those of you that didn't know, now you know as well. There are those three types of ADHD. Gabriel, good question. So is the inattentive type more difficult to identify? It is more difficult to identify because it's not as expressive, right? When we think about ADHD, we think about the typical child, right? We oftentimes don't think about the adult, but when you think about ADHD, you think about the child who's like fidgety, who's running around, who's hyperverbal, who's all over the place, right? So that is the hyperactive, impulsive type. But the inattentive type is the individual, right? The child, the adult who's more like distracted. So they seem more distracted, but because it isn't so intense, it can definitely be overlooked more. So really good question. Thank you. So anyways, there are three types of ADHD, and you have to meet the criteria, or you have to meet the 6 symptoms in order to get the diagnosis, and they have to be present for the past 6 months. Usually these symptoms interfere or reduce the quality of your functioning. It's inconsistent with your developmental level. What does that mean? A child who is 2 years old, 3 years old, even 5 years old, who's climbing over furniture, who's like running around the place, that's pretty developmentally appropriate. However, a 9-year-old who's doing that is not very developmentally appropriate, right? So we have to look at those symptoms in terms of what is developmentally appropriate for that child. And then the symptoms have to be present prior to age 12. Again, this is a neurodevelopmental disorder, which means that it starts from the very start. You cannot just get ADHD after, right? It's not like someone sneezes on you and you're like, oh, I have ADHD now. No, that doesn't happen. The other interesting thing is that the symptoms have to be present in 2 or more settings. So it's not that it only happens in school. It has to happen in school. It has to happen at home. It has to happen really in general or different types of settings in order for you to get that diagnosis. I have a question here. Can you have autism and ADHD? Very interesting question. So when we had the older DSM years and years ago, you could not diagnose ADHD and autism together. In the newer versions of the DSM, you can actually diagnose autism and ADHD, because some of the symptoms, even though they correlate, and perhaps my next presentation can be on autism and ADHD. I don't know if you guys are interested, but even though some of these symptoms are very similar, sometimes the intensity of some of these symptoms are more attributed to ADHD than autism, if that makes sense. All right, so let's move on. Yes, there is comorbidity, which means that they can co-occur together. All right, just trying to make sure you guys are not asking. I mean, I haven't missed any questions. Again, ask whatever questions you have, because I'm just looking at that and looking at the PowerPoint. Yes, it's very common. So there's a message here. I have a child with both ADHD and ASD, so it is very common. Also, it's really important to go to a psychologist that has experience diagnosing one or the other. Not a lot of psychologists have experience with ADHD and with autism. I happen to have experience with both, but there's not a lot of psychologists that are very savvy with it. So even though they use a lot of objective measures, or I would think they do, sometimes you need that clinical experience. You need that clinical experience to really be able to say, okay, these symptoms are more attributed to autism rather than ADHD, or maybe the individual has both. At the end of the day, the individual is an individual regardless of their diagnosis, right? Okay, another question. How about in adults? Issues with procrastination and time management. Yes, very good. So let me put that question, I'll answer that question at the end of this, so we can definitely speak about adults with ADHD, because you read in my mind, my PowerPoint's mind. So let's look at the first type of ADHD. We have ADHD inattentive type. So this type of ADHD, and I want you to kind of think about this child or this individual that's kind of like, not paying attention, they're very distracted. In Spanish, I remember they used to tell me a lot, like, estás en las nubes, you're in the clouds, right? Because I was very distracted. So those are things that we tend to hear. They tend to avoid engaging in tasks that require sustained mental mental effort and attention. A lot of this time it's reading for some reason. They fail to give close attention to details or make careless mistakes. So a lot of these kiddos or a lot of these individuals that have ADHD and inattentive type, they tend to write very sloppy, or they'll write and they'll misspell things, but it's not because they don't know how to spell it. It's just that they're like focused on something else or something distracted them. They don't follow through on instructions and fail to finish tasks. They have difficulty sustaining attention in conversations or record or even reading. So you can already start seeing how this can get in the way of peer relations, right? So if someone is like speaking to you and you're like not paying attention, that person can think that you're rude if they don't know that you don't have ADHD. And then you can feel bad because you're like, oh my gosh, why didn't I pay attention to what they were saying? Also, they don't seem to listen when spoken to directly. So some people may think that they're just being non-compliant or rebels, right? They lose things necessary for tasks or activities. They're very disorganized. Everything is all over the place. I'm not going to show you my desk because I'm not going to show you my desk. But anyways, they're distracted by extraneous stimuli. They're forgetful in daily activities. So these are just some of the symptoms. And remember, who remembers how many symptoms you need in order to meet the diagnosis of ADHD and attentive type? How many? All right, you guys are listening. Yes, 6. You need 6 of these symptoms. All right. So the second type of ADHD, and this doesn't go necessarily in this order, you just, this is just the second type that we'll speak about, is the hyperactive and impulsive type. This is the ADHD, when we think about ADHD socially, like this is the ADHD that comes to mind. So this is the individual that blurts out answers before a question has been completed. They leave their seat in situations when remaining seated is expected. They run about or climb in situations where it's inappropriate. Again, developmentally appropriate. If you're 2 or 3, that's fine. But if you're 10, that may not be really developmentally appropriate. They tend to fidget with or tap hands or feet or squirms in their seats. They're unable to play or engage in leisure activities quietly. They're always on the go. They seem like they're driven by a motor, right? Some people are like, wow, they have so much energy. They're hyperverbal, which means that they talk a lot and very quickly. They have difficulties or experience difficulties waiting for their turn, and they tend to interrupt or intrude on others. Again, you can kind of see the social impact that this can have. When an individual like this is interacting with others, right? They may seem rude, they may seem like they're not listening, they may even seem like they're narcissistic, or they're just, they want to get their thoughts across and really disregard what everyone else is saying. So this is ADHD hyperactive or impulsive type. All right, so before we go to the things to know, who remembers or who can tell me the 3 types of ADHDs that we have? What are the 3 types? Even if you just kind of, type the first 3 letters quickly.
4.
Okay, inattentive, hyperactive, and combined. Very good. Yes. Those are the 3 types of ADHD. Basically combined, we didn't go over it, but it's combination of some inattentive symptoms with some hyperactive symptoms together. Yes. Well, it's inattentive, hyperactive, and impulsive is 1. And then we have combined, which is number 3. So you're close. You guys are listening, which is the point of this. All right, so let's talk about things to know about ADHD. So the biggest pet peeve for me, for whatever reason, is that people still call it ADD. So, a lot of people don't know that it's no longer ADD, that now it's just ADHD. But my biggest pet peeve is when professionals do this, right? Because I've seen psychologists still call it ADD. I see pediatricians still call it ADD. And now when they do, you guys can kind of tell them like, nope, it's ADHD. ADD used to be attention deficit disorder, but that was like years and years ago. Now we have ADHD and we have those 3 levels. So these are some other things to know about ADHD, is that the prevalence is 7.5 in children and 2.5 in adults. Now, I don't know about you guys, but I think that number is extremely low. Remember that those numbers, and this was taken from the DSM-5, but remember that these numbers are also the people that actually go to therapy. There's a lot of people that have ADHD that don't go to therapy because it doesn't really interfere in their life, or they've learned how to cope with it. So, but this is what the DSM tells us. There's also different presentations depending on age. So usually the hyperactive symptoms tend to lessen as the individual gets older, because the individual gets older, you get more tired, you tend to not be so hyperactive just normally. So there are different presentations depending on age. Also, with age, we gain more experience. So we learn how to cope with these symptoms. We learn how to mask these symptoms a little bit more. So that absolutely makes sense. There's also a high indication of heritability. What does that mean? That usually when one person has ADHD, either mom or dad have ADHD, or someone else in the family has ADHD. So, okay, I have a question here. What do you think of medication for ADHD? Okay, we'll definitely get to that. Something else that is sort of a myth is that family interactions in early childhood are unlikely to cause ADHD. So you're not going to have ADHD just because you, or your child, right, as a parent, your child is not going to have ADHD just because you didn't discipline them well when they were little. Like that's not how, ADHD is a neurodevelopmental. So it comes from a very early age. It has nothing really to do with that. However, it may influence the course of ADHD or contribute to the secondary development of conduct problems in children because they already have ADHD, right? So not knowing how to intervene in the child's behavior when they do have ADHD may make the symptoms worse and may lead to other comorbid conduct disorders and other comorbid disorders as well due to that fact, right? That's why we have behavior therapy, and that's why it's so important for you guys also to learn other methods if the ones that you're using are not working. So there's mild delays in language in children with ADHD. We see some motor and mild delays and also social development. There's few noticeable features. So there's the hypertelorism, the highly arched palate, and the low set ears. So sometimes we see some of these features in ADHD. So the hypertelorism is when your eyes are far apart. This is not very common, but this is what the DSM tells us. And then of course, academic difficulties. So we start seeing these symptoms interacting with school, and that's when usually parents bring children to get a psychoeducational evaluation in order to get the diagnosis or rule out a diagnosis of ADHD, because this is when, the symptoms start getting in the way of academic skills. So medication. So I'm not a psychiatrist. I'm neither for nor against medication. I think every child is different and should be evaluated as such. But I do think that sometimes when children have already gone to therapy, when parents have done parent training and you've really exhausted all the resources and you see that the child is just not catching up and is, suffering and is going through all of these difficulties or experiencing these difficulties, then perhaps medication can help. Medication does help for the symptoms. Another thing to keep in mind is that medication will help it will help some of the focus or concentration symptoms, but it won't teach them what to do instead. It won't teach them coping skills. So medication on its own, I don't think it's a good idea. I think it should be coupled with therapy because we want to teach replacement behaviors. We want to teach all these other things. Yeah, Diana, yes. I didn't know about the noticeable features either, to be honest with you, until I read it in the DSM. But yeah, it's pretty interesting. Any questions about medication? What do you guys think? Questions about ADHD before we get to GAD? Okay. My older child has been diagnosed with ADHD, ODD, and anxiety. For those of you who don't know, ODD is oppositional defiant disorder. We have tried multiple therapies. What are the best techniques, therapies he's on medication to? Okay, so ADHD, ODD, and anxiety is I'm sure a lot. So I think that going to, again, a psychologist who, not saying that the people that you've been to have not been good, but making sure that the psychologist, the therapist that you go to is experienced in these disorders. I think that is the number one thing. And that if you're going to, for example, if you're seeking behavior therapy is going to help in terms of like behaviors, right? If you're going to a psychologist like for emotional help, then that will help for that. So I think going to the right psychologist is really, really important, and a person that has experience with that. Also, it's not just a psychologist, because you don't have a magic wand, as a lot of you think. The parents also have to be on board. The school has to be on board. Everyone has to be doing things consistently. So that's the other part that is really important as well. Another question, are ADHD and OCD related? So they're not related per se, but there can be some symptoms that correlate. There can be some symptoms that, you know, look alike in some way. Like some of the fidgeting or some of the repetitive things in ADHD can kind of look like some OCD behaviors or symptoms as well, but the core or the reason why they are done is differently, right? ADHD is more about that, you know, repetitive, just repetitive, like not really goal oriented, like fidgeting, the ones that we see in ADHD hyperactive type. And for OCD, it's more about, I have this anxiety and then I'm going to engage in this behavior in order to remove this anxiety, right? And then it becomes repetitive. So it's a little bit, the mechanism behind it, it's a little bit different, if that makes sense. You can have ADHD and then develop OCD traits. But it can't go the other way around, because you cannot develop ADHD later on. All right, so let's talk about adults with ADHD. And I think someone had a question about this. So adults with ADHD. So obviously kids become adults, and ADHD, if it's there, is really there to stay, right? It's not like we can just get rid of ADHD, like take a pill and it goes away. So adults with ADHD tend to have difficulties keeping a steady job, have more motor accidents than other people diagnosed with other things or not diagnosed. The propensity to be incarcerated is also greater. There's abuse, we see a lot of substance abuse, and a lot of the time this is actually to kind of like cope with the symptoms, right? They're self-medicating. And there tends to be poor relationship with peers and family members. So these are just some symptoms or some things that we see with adults. Someone had a question about adults and issues with procrastination and time management. Now, we all have issues with procrastination and time management. If you tell me that you don't have these issues, then I mean, you got to tell me everything you're doing, because everyone, I think, has some issues, right? But yes, adults or kids that have symptoms of ADHD do have some difficulties with procrastination and also managing their time adequately. I like to talk about the other side of ADHD, because I think that as much as we look at these different diagnoses as symptoms and as challenges, there's also sort of like a bright side to it. It's not to say that this ADHD and anxiety can be very complicated and very impairing. It can definitely be, but this is sort of like the other side of ADHD. So sometimes the hyperfocus, or someone who's extremely hyperfocused on something, can also be productive when they apply it at the right time. Hyperfocus is something that is not often spoken about in ADHD, but we see a lot, right? So individuals may kind of like, let me give you guys an example. Think about the house being a complete disaster, but then this person just spent like the last 8 hours organizing their little closet, right? But the whole house is like falling apart. So that's an example of hyperfocus. They hyperfocus on something and can actually ignore everything around them and do that thing they're focusing on really well. The goal here is making sure that you're focusing on something that's going to help you or add. Imagination, creativity, flexibility, and their thinking structure. So some people that have or meet the diagnosis criteria for ADHD tend to be creative, tend to be flexible. They think outside the box. A lot of entrepreneurs have ADHD, a lot. They're impulsive. So this means that they have quick reactions. Imagine a nurse in the emergency room. Do you want this nurse to be a perfectionist? Do you want this nurse to be like, well, give me some time to look at these books and see what I'm going to do? No, you need for that nurse in the emergency room to think on their feet and to think quickly. Firefighters, right? So there's a lot of professions where you have to be impulsive, and that works for you. Obviously, the right type of impulsivity, right? They're humorous and they're full of energy. They tend to be spontaneous. They're willing to take risk, and they tend to multitask. And last but not least, they're highly organized and punctual. So people with ADHD are highly organized and punctual. What do you guys think?
Yes.
Okay.
Yeah? Okay, someone's saying this does not sound like ADHD to me. Okay, gotcha, because it isn't. So they're not very organized and they're not punctual, but that's okay because they have other attributes and I think other strengths, right? I just wanted to make sure you guys were still with me here. I know, Diana, you were like, what? What is she saying? All right. So treatment for ADHD. So we spoke about medication, some common medication. Again, I'm not a psychiatrist and I do not prescribe medication. Although for some reason, my family members in Christmas, they always think that I prescribe medication. They're like, hey, can you like give me, I'm like, no, I'm a psychologist, not a psychiatrist. But anyways, medications, stimulant medications such as Ritalin, and Adderall are commonly prescribed. We've heard a lot about these types of medication. Behavior therapy, so things like CBT, like ABA therapy. By the way, ABA therapy, it's not just for autism. ABA therapy is for ADHD and all types of disorders and not even diagnosis, right? Just people that are facing behavior difficulties. And it's not just for kids. ABA therapy is also for adolescents and for adults and for everyone. I just want to really clarify that. Social skills training, social skill groups and support groups as well. These are all therapies that people with ADHD would benefit from. If you're a child or if you're a parent, right, parent coaching, parent training is really important, more so with ADHD. Sometimes it's also important for parents themselves to go see a therapist. I know that a lot of my therapists that work at Crystal Minds, they sometimes shy away from telling therapists like, from telling parents, sorry, like, hey, maybe you should see someone, right? Because there's no like great way of saying it. But honestly, if you're able to help yourself, then you can help your child even better. So it's completely okay for parents to go to therapy. I'm a parent myself, and I know how hectic and how difficult that can be. So definitely therapy for everyone, I think. Education support, so IEPs, working closely together with the teachers, with the counselors in the schools. Lifestyle changes, so exercising, balanced diet, adequate sleep, these are all things that can help. And as I mentioned, also support groups for parents, support groups for children as well. Let's see, comments. ABA therapies transform my child's life for good. Absolutely. I mean, I'm an advocate for ABA therapy because I've been in ABA for about 15 years. I've been an ABA therapist for about 15 years. So I definitely can see, you know, the great that comes with it. Why is ABA therapy not covered by insurance for ADHD? Good question. So back in the day, like years ago, ADHD was not even covered. ABA was not covered for autism, right? But then parents started pushing, started advocating for it, and then insurances saw that there was a lot of empirical support, and they started covering it. Now, there is some empirical support, meaning that there are studies that show that ABA is effective with ADHD, but the majority are done with autism. So I think our field is shifting a little bit, and perhaps in the future, insurances will start covering ADHD. As of now, they don't, just because of that. IEPs can give extra time, which can help a child with ADHD. Absolutely, IEPs can do that. All right, so let's quickly jump to generalized anxiety disorder or GAD. So remember, generalized disorder is a type of anxiety disorder. There's also other types of anxiety disorders like selective mutism, like social anxiety disorder, panic disorder, all of that. So GAD, you need 3 or more of the following. So 3 or more of the following symptoms. Usually for children, you just need 1. And the duration has to be for 6 months. So you have to be feeling these symptoms for at least 6 months. If you're feeling it for 5 months and a half, no, you don't meet criteria. For this disorder, you need it for something else. So what are the symptoms? Restlessness or feeling keyed up or on edge, being easily fatigued. So even though you are sleeping, you do have a good diet, you just feel exhausted and tired all the time. Difficulties concentrating or your mind going blank. So a lot of the times the symptoms or someone who has ADHD may seem like, or they do actually have difficulties concentrating. But the reason for that is because they're not focused, because they are looking at extraneous stimulus and they're distracted. Someone with GAD has difficulties concentrating because of all the thoughts that they have in their minds, right? So this is like a difference between ADHD and GAD. Irritability, so oftentimes they're irritable. Muscle tension, so they seem to be tense. Sleep disturbance, so they have difficulties falling or staying asleep, or restless or unsatisfying sleep. So even though they do sleep, they just feel like they haven't slept. And they find it difficult to control the worry. The worst thing that you can tell someone with generalized anxiety disorder is, hey, just don't think about that anymore. Well, obviously, if they could just stop thinking about it, they would. But it's very, very difficult to stop. It's intrusive thoughts that they have to deal with. So why is it only 1 symptom for children? Good question. So usually for children, it's milder and they tend to not have the verbal capacity sometimes to speak about, these other symptoms. So usually for children, they just have to meet 1 of these symptoms. Yes, it can feel impossible to control GAD, absolutely. All right, so things to know about it, the prevalence. So GAD is one of the most common anxiety disorders, with a lifetime prevalence estimated 5 to 7% of the general population worldwide. Again, I think this is really low, but it is commonly diagnosed in women more than men. I think there's, the way that we are socialized as well, it tends to be different. So it's very rare for males to go to therapy for anxiety. You see more females go to therapy for anxiety. Males will go to therapy more for like the substance use or something like that, even though there could be that underlying GAD there, right? Which is interesting. The stigma, absolutely. Age of onset. So when does GAD start? Remember, ADHD started from birth. GAD can happen at any point in time, but usually it develops gradually and can start at any age, but it's more common in childhood or adolescence, and it can emerge in adulthood with around 1/3 of cases starting at the age of 18. Comorbidities, so you see a lot of co-occurrences with other mental health disorders, such as depressive disorders, substance use, so a lot of different comorbidities there. Risk factors. So certain factors may increase the risk of developing GAD, including a family history of anxiety disorders, exposure to stressful life events, neurobiological factors, and personality traits such as perfectionism or neuroticism. Other things to know about GAD is that children tend to worry about catastrophic events. So they tend to be overly conforming or perfectionistic, as we mentioned, and they tend to seek constant reassurance. And females are more likely to receive this diagnosis, as we spoke about, even in kids. Some symptoms in children may be a little different. We'll see the anger, we'll see the difficulty sleeping, the defiance, lack of focus and concentration, and avoidance. Remember also that children don't have the verbal capacity that some adults do, so it's difficult for them to even express some of these symptoms. So you'll see a lot of like the tantrums, you'll see a lot of that avoiding, that kind of rigidity behavior with certain things that they're avoiding. All right, what are some common treatments? Some common treatments are physical activity, including cardio. Cardio actually helps. It's not one of these like things that people just say because they want you to exercise and do cardio, but it actually helps physiologically. If we think about generalized anxiety disorder, it has a lot of things to do, not only with your brain, but with your with your physique, right? With the way that you breathe, with your heart palpitation, with all of those things, with tensing and untensing your muscle. So it just makes sense that when you're able to regulate your breathing, you're able to take more control of your breathing. And we see this in relaxation techniques or progressive muscle relaxation, meditation, right? Where we're doing this, when you're able to do that, you can regulate these symptoms a little bit more. Mindfulness, as I mentioned, is really good as well. Now, I don't like mindfulness. I'm a therapist, but I don't like mindfulness. I have done mindfulness with my clients, but it's just not my thing. It's really hard for me to like be in the moment, and I get very distracted, and I'm more about something that's quicker or just, I don't know, different, right? But if it is for you, if you really like it, things like yoga have that mindfulness in them as well. So those are things that, you really have to find like what your coping strategy is, but it has to really fit to your personality. CBT is good as well. I have a book, it's called Bully in the Brain, that I read to the kiddos that have some of these presenting symptoms, and it's an interesting book. I'll also post it on social media after this so you guys can take a look at it, but it's one of my favorite books actually, and it's very like cartoonish and they tend to like it. So CBT works on teaching individuals to identify these negative thoughts, challenging or disputing these irrational thoughts, and replacing them with a more realistic one. And then building a relationship with your anxiety. We'll talk a little bit about what that means in a bit. Treatment, antidepressant, buspirone, anxiolytics, these are different types of medications.
At the debate, she's gonna do a ton of word salads and
All right, so let's talk a little bit about the development of GAD in individuals with ADHD. So individual already has ADHD symptoms, either inattentive, hyperactive, or both. And how do they develop generalized anxiety later on, right? So that's sort of like what we're going to take a look at. So when we look at societal pressure, so the pressure that we all feel from society, I'm sure that you can kind of like think back to those symptoms of ADHD and picture how a child with ADHD, an adolescent with ADHD, an adult with ADHD can kind of like clash with some of these societal pressures. So people with ADHD might feel pressured by society to conform to norms related to attention, organization, and impulsivity control. Struggling to meet these expectations, especially without an ADHD diagnosis, can lead to feelings of inadequacy, frustration, and anxiety. So think about someone who is always arriving to work late. Like they have tried everything in their power and they still get to work late because they have poor time management, right? Or they're very disorganized, they can't find their keys, or they're very inattentive, or they tend to get in a lot of like motor accidents, right? Because of the ADHD. So you can see how this can impact their performance at work, and also their relationship with their boss and perhaps with their colleagues. So because of this societal pressure. Now, I mentioned here, especially without an ADHD diagnosis. So and I spoke a little bit about this during a post or a story that I posted this morning. And I think that it's super important that children or adults or adolescents or whoever it is, that we become aware of our symptomology, or if we have a certain disorder or if we meet criteria for that disorder, because it's not that it helps us justify and say like, oh, I don't care, I have ADHD, I don't have to like do any of this, right? But it helps you like kind of conceptualize and explain some of your behaviors, so you don't like take it all in. You don't feel like it's all just you, if that makes sense. So let's look at the hyperactive type of ADHD and see how these societal pressures tend to play a role on this in developing generalized anxiety disorder. So individuals with hyperactive type ADHD may struggle to control restlessness, impulsivity, leading to overwhelm and anxiety. Socially, they may face anxiety due to their impulsive nature. So perhaps someone who's always blurring out things, right? I have a best friend, and she gave me permission. I'm not gonna say her name, but she gave me permission to use this information. But she definitely has ADHD, hyperactive type and impulsive type. And I remember growing up with her, and like, you know, at first I would tell her secrets, or I would tell her like, oh, look, that boy is kind of cute. And she would literally like blur it out, like, hey, you know that she thinks you're cute. And I was like, what? I was mortified because I was like very introverted. So I still, you know, continue to be her friend until this day. We're BFFs, but you can see how this can obviously get in the way of peer relationships because of the impulsivity or this impulsive nature. The inattentive type, so when we look at the ADHD inattentive type, they may struggle with organization, they may forget, they may lose focus. This contributes to anxiety and fear of failure. So socially, they might seem distant or inattentive, leading to negative self-perception. So perhaps someone who has ADHD inattentive type, in a social situation, they may not be socializing with others, and you know, they may be thinking about something else, or they may be distracted by other things. So they may just seem like they don't want to be there, or they don't want to be with those people, with those group of people, which can lead to isolation. Now, let's look at the inability to process emotions, or the difficulties with processing emotions in these types of ADHD that then leads to anxiety disorder. So William Dodson actually coined the phrase, I completely just forgot it, but of course, but it's something sensitivity disorder. So this R sensitivity disorder, which I'll get back to you guys on that. So this is actually a reactive sensitivity disorder. So this has to do, and this is not really a concept that is in the DSM-5 or a concept that has a lot of empirical research, but he described it, and I just thought that it was very interesting the way that he described this. So I'll tell you guys exactly, like I have the quote here, but the way that he described it, I think can resonate with a lot of people. So he said, it's a triggered, wordless emotional pain that occurs after a real or perceived loss of approval, love, or respect. So I thought that that was super interesting, the way that he described what this was, right? And there has been a lot of links between people that have a diagnosis of ADHD and this sort of like perception that other people are disapproving of them, or other people are rejecting them. So individuals with ADHD often encounter difficulties in processing emotions, impacting the development of GAD, generalized anxiety disorder. And here's how the slow processing of emotions can affect those with ADHD and contribute to anxiety. So when we look at the inattentive type ADHD, let's again picture all of the symptoms of someone with inattentive type of ADHD. So this person doesn't have a lot of attention, they have issues with focusing, and this can impede their emotional processing, causing there to be like difficulties in recognizing and addressing emotional needs. So this can result in confusion, isolation, anxiety over feeling misunderstood, and rumination, which are all common features of ADHD. Additionally, processing emotions can be challenging, impacting relationships and escalating feelings of uncertainty and social discomfort, further contributing to anxiety in various contexts. When we look at hyperactivity type of ADHD, impulsive and hyperactive behaviors associated with this type can really hinder emotional processing, leading to outbursts, misinterpretations of social cues, and challenges in effective expression of feelings. And this also triggers anxiety. So what does this look like? Imagine, you know, an individual that, you know, and this is not really like, you don't have to imagine it too much, but I'll tell you guys like an example. There was this individual who, you know, some of his friends didn't, you know, told him something and he really didn't like what they said, and he didn't listen to the rest of it because forget it, they're already like, you know, being a certain way with me, so I'm just going to blow them off and never speak to him again. Okay, so that kind of pattern, right? That kind of pattern of like, I feel rejected, so forget you, and I'm not even going to wait, think, and process this, right? So oftentimes when someone tells us something that may be hurtful, what some of us do, or what we teach people to do in therapy, is to wait, to stop, to think about it, and then use, you know, kind of question it. So did they say this because they don't like me, or did they say this because they're having a bad day, or did they say, you know, so do all of that. Someone with ADHD that is just, their thinking is just, you know, super quick. It's difficult for them to do that, and they just go from point A to point D. They don't go through all of the steps, right? So what we do in therapy is that we teach them to slow down and kind of go through this process. Okay, questions. There's a question here. Is GAD the same as social anxiety? Good question. So GAD and social anxiety are kind of like in the same anxiety family. So think about it as an anxiety family, and we have their selective mutism, we have panic disorder, we have generalized anxiety disorder, we have social anxiety. So they're all there together. There are similar features. The main difference between social anxiety disorder and GAD is that social anxiety disorder is specific to social interactions. So these are people that fear or try to avoid social interactions because they have that fear of rejection or performance, like speaking in public, eating alone, you know, those kind of things. Generalized anxiety is basically anxiety about everything. That's basically what that means. Okay, so we are, of course, running out of time, so I'll try to go quickly with this. I said a lot of these things, but this is just a comparative of ADHD and anxiety and the comorbidities. So a lot of these were already mentioned, and they're also in the manual that I will drop here. I'm going to drop the link over here so you guys have it. So what happens in the brain is pretty interesting. So when we look at ADHD, the prefrontal cortex, which is this front part of our brain, is the part that's responsible for decision making, for planning, for impulsivity, and it also helps in regulating your emotions in some way. So there have been studies that when people have traumatic brain injury and they hit or they damage their prefrontal cortex, they will automatically be impulsive. They will automatically have problems with executive function, problem solving. So we see a lot of these different kind of behaviors show up, right? So the basal ganglia helps regulate movement and attention. We may see that as well. Anterior cingulate cortex plays a role in emotional regulation and decision making. The cerebellum. So the most important things about this is that when we look at the similarities between ADHD and GAD, we see the prefrontal cortex. So in both ADHD and GAD, the prefrontal cortex is in some way there's you know, there's like a hindrance there. And that helps in the emotions, regulating emotions, and again, controlling this impulsivity. Also, the anterior cingulate cortex plays a role in emotional regulation or error detection. And you see some compromises in both ADHD and also GAD. All right, so we're almost at the end of this, but let me ask you guys a question, and please put it on the chat. If I could give you a pill right now, so you could get rid of your anxiety forever, and this pill had no side effects, would you take that pill? Who says yes? Who says no? No, yes, no, yes. All right, so like half and half, no, no, yes. I'm curious, those of you saying no, why wouldn't you? And those of you saying yes, why would you? By the way, if you were at the office today and you heard me talk about it, that doesn't count because you already knew what I was gonna say. Okay. Okay, it's not as bad, so you can manage so you wouldn't take the pill. I didn't hear you. I think having I think having these feelings are needed in our daily lives. I think anxiety is all in my mind. Well, kind of. Okay, medication and therapy. Yes, combination of medication and therapy. So let me tell you guys something. If you were to take this pill, what would happen if a huge grizzly bear came into your house? What would happen if you took this anxiety medication that probably had to do, something in your brain and your fear responses would go away? What would happen? Diana, you are on it, girl. It's necessary, absolutely. So you know what would happen? You would probably like hug the bear and then get eaten by the bear. So anxiety is needed, right? Anxiety helps us go. It is our motor sometimes for getting out of dangerous situations. It's what helps us fight and flight. It helps us get out of these dangerous situations. When it starts going against us, that's when it becomes troublesome. It is imperative. Let me see. I will be strong. Okay, depends on the dosage, but chaos. Okay, good, good. So this is a love story. How to befriend ADHD and anxiety. So I'm gonna give you guys like, I guess the bad news and some of the good news. So the bad news is that if you have ADHD, if you have anxiety, it's probably gonna stay, right? Like it's not just going to go away. You'll just learn to live with it, like a pesky little roommate that you want out of your house, but they never leave and you just have to like deal with them. So that is probably what's going to happen with ADHD and anxiety, whether you have one or the other, or perhaps both. So instead of fighting against it, there's a lot of like theories of mind, and I use this a lot in my therapy sessions with my clients. It's how do we learn to befriend our anxiety and our ADHD so it works for us and not against us. So the first thing is self-acceptance. If you have ADHD and or anxiety, you have probably learned that is there to stay. So how do you learn to really accept it and live with it? Empowerment and resiliency. By befriending ADHD and anxiety, you can gain a sense of empowerment. Shifting perceptions. Instead of viewing ADHD and anxiety as hindrances, befriending these conditions encourages a shift in your perception. Embracing uniqueness, right? Like, so we're all different, and that's actually a good thing. Why do you want to be like everyone else? So befriending ADHD and anxiety involves celebrating one's uniqueness and understanding that these conditions contribute to shaping our identity. Enhancing relationships through communication. So embracing ADHD and anxiety, you can enhance your relationship with others. And preserving energy. If we stop fighting against it and we just learn to befriend it and kind of like move forward and how do we use these challenges to shape other things and strengths to shape us, then we'll have more energy to do other things that are necessary. So these are just some of the, I guess, takeaways from befriending ADHD and anxiety. So we'll open it up to questions now, but here are my Instagram handles. If you guys want to communicate with me after, you want to ask me questions, whatever it is, I can, send this to you. I'm going to put it again in the chat. If you click on this link, you should be able to access the manual that I have here as a gift for just coming to this webinar. Again, I do these webinars once a month. So any suggestions, any like things you want to talk about, please let me know and I will try to do that. Questions? Oh, okay. They're here. Thank you, Gabriel. I'm glad you liked it. So I feel anxious when I'm about to confront a situation I have never been in, and my anxiety is telling me that I might need more preparation or not. Yes, Diana, that is such a great point. Thank you so much for bringing that up. So sometimes we feel anxious and we just ignore it or we want to fight it or whatever. But instead, let's start asking our anxiety, what is it telling us? What is it telling us, right? Maybe it's telling us something irrational that has nothing to do with anything. But like Diana said, and this is a perfect example, she said, when I try to confront a situation that I'm in, sometimes the anxiety is telling me that I might need more preparation or you know, that then maybe I don't have to be there. Like, so the other thing is, I remember that I had this client that used to tell me, well, I have so much social anxiety, but it's only when I'm with these group of people and I want to know how to cope with it. And I asked them and I said, have you ever thought that maybe you shouldn't hang out with those group of people? If being in that group of people like causes you so much anxiety, then maybe it's not your anxiety, maybe it's the group of people, right? So just something to think about, to keep in mind. Thank you for coming. Thank you guys. Let me see. Question, suggestion, AAA, autism, ADHD, anxiety, presentation. Good. That's actually, those are the three things that I specialize in, Gabriel. So autism, ADHD, and anxiety. So, okay, I like that. Maybe we can do something with autism and ADHD or anxiety. Definitely. Thank you. I'm glad you enjoyed it, Maria. Hello. OCD, ADHD, and ASD. Okay. At this point of the night, everyone's like ADHD. What are all these letters, right? Coming together. But definitely, thank you. Is it hard for me to follow through with the strategies that I'm being taught? Yes, a lot of the times when we start applying interventions or doing things that are not something that we normally do, it can be difficult in the beginning, definitely. Really. Thank you, Maria. Nice seeing you through here. If you can also help us with strategies at home and behavior, will be very appreciative. Yes, definitely. So we can have maybe a presentation on some strategies to use at home. I think the most important thing, and I've done presentations on identifying the function. So always ask yourself, why is a child or the individual engaging in these behaviors? And then what can we use as an intervention, right? So, you know, that can be a little tricky sometimes because you may need more intensive therapy, but definitely I can do a presentation on that. Thank you for coming, Zachary. So I'll leave it like 30 more seconds to see if you guys have any last minute questions. Again, the manual, I put the link there. You should be able to access it. I'll see you guys for the next presentation. If you guys have any follow-up questions, let me know. I'll also post a book on my social media so that you can see it. I think you can get it like an Amazon and it's like, I don't know, $12, $15, I'm not sure. So I'll put it there too, just so you guys have it. Thank you for coming. Good night. Good night. All right, so I will let you guys go so that you have an amazing night, well-rested night, and we will see each other on the next webinar. Bye.